is actually most prevalent of all the substance use disorders. And it's been estimated that every year almost 100 million individuals suffer from alcohol use disorder. Now, at-risk drinking has been defined as drinking more than 14 drinks per week or 4 drinks on an occasion for males, and greater than 7 drinks per week or 3 drinks on an occasion for non-pregnant females. There's another thing that Dr. Shah Jahan talked about, it's binge drinking. So binge drinking is defined as excessive indulgence in alcohol consumption for at least 2 days, where a person gives up all of their usual activities and obligations and is just focused on drinking and drinking-related activities. As psychiatrists, we use the DSM-5, which is a manual to diagnose psychiatric conditions. And alcohol use disorder is a psychiatric condition, so there are 11 criteria that I mentioned, including craving, tolerance, withdrawal, and based on the number of criteria you meet, it's classified as mild, moderate, or severe. So just like any other medical condition, there is severity of alcohol use disorder as well. So for the risk factors for alcohol use disorders, just like any other medical condition, there is a genetic basis for alcohol use as well. There is a 50 to 60% chance of inheriting alcohol use disorders. And early onset drinking is a risk factor for development of this condition. So our youngsters, our teenagers who start drinking early on in school or colleges, they have a higher risk of developing alcohol use disorder. Living in high stress environments or working in high stress environments, that also increases the chances of drinking. Social availability and cultural norms. So sometimes in our culture we see ki oh falane di khatardari karni hai, kidda kariye, chalo alcohol, ya vyahan te alcohol. And it kind of becomes culturally normalized in that sense, and that also increases the chances of development of this condition. And the problem is also ki asi jida apne culture which we use certain words jida sharabi ya nasheri, jida the words we use karne hai, asi onu we turn that into a stigma. Te jinna nu hai problem hai, people don't seek help ki what if somebody finds out that I'm drinking alcohol, te mainu sharabi kehnge, mainu ai kehnge. Next slide. So there is a neurobiological basis for alcohol use. As if कोई behavioral issue नहीं है कि खाने का मन करता है ते ताई बीमारी हो गई है. We won't say that somebody is a diabetic, it's their fault. We'll not try to create a stigma around that condition. There is actually neurological basis, brain with changes देखे जाने हैं. So in short term, when people just start drinking, there is more sedation, there is reduced anxiety. कुछ brain के chemicals होते हैं जिदा GABA, and other neurochemicals. Initially, they make you feel more calm and relaxed, and there can be memory impairment, there can be blackouts. And then there is reward in learning through the dopamine pathway. So like brain the chemical on that dopamine, they increase karda, spike karda, we start feeling ki we need to do this activity a lot more jada see more conditions which weakne, just like gambling or video games like Dr. Shah Jahan was talking about earlier. So and once this becomes a self-sustaining pathway, it becomes really powerful. Eventually you stop needing cues. If you see someone drinking, or if you are, even the smell or the vision or thought about it can trigger somebody into drinking alcohol. Alcohol, the long-term effects on the long-term effects on the brain. Our brain tries to restore the neurochemistry. Jade chemicals initially alcohol ne thode kharab kitte hai, brain tries to compensate for that. So we need more and more alcohol to get the same effect, and we call that tolerance. Mood symptoms start worsening in the absence of alcohol use. There is a higher chance of developing anxiety and depression. So when my patients tell me, oh, alcohol makes me feel more calm, alcohol makes me feel happy, I actually tell them it's a depressant. And when it leaves your system, it causes withdrawal anxiety. Jehdi pehle thodi ji anxiety aani si, jehdi loki drink karde hai, wo same stressor naal anxiety is tenfold. And the brain becomes hyper excitable. withdrawal symptoms in there. And this is something that, it's really important to recognize that alcohol is one of the substances whose withdrawal symptoms can cause death. If withdrawal now death ho sakdi hai. So we don't tell anybody to, okay, well, just stop drinking cold turkey. Kar vich beh ke band kar do. That's not safe. If you've been drinking for a while, if you have alcohol use disorder, please seek medical help. Going to an inpatient facility, hospital which voluntary admission kar sakde ho, jithe jaake tanu dawaiyan deke, they can safely help you come off of alcohol. Kyunki in certain cases, there can be severe withdrawal symptoms like seizures, hallucinosis, loਕਾਂ ਨੂੰ ਚੀਜ਼ਾਂ ਦਿਖਣ ਲੱਗ ਪੈਂਦੀਆਂ ਜਾਂ ਸੁਣਨ ਦਿੰਦੀਆਂ ਆਵਾਜ਼ਾਂ. There is a condition called delirium tremens, which can be associated with confusion, fever, autonomic instability, blood pressure changes, and in all, there is a high risk of mortality. Next slide. And alcohol affects a part of the brain which is called the prefrontal cortex. The part of the brain that helps us with our decision making, executive functioning, planning. Alcohol brain ਦੇ ਹਿੱਸੇ ਨੂੰ affect ਕਰਦੀ ਹੈ ਜਿਹਦੇ ਨਾਲ ਅਸੀਂ ਸਹੀ ਫੈਸਲੇ ਨਹੀਂ ਲੈਂਦੇ ਜਿਹੜੀਆਂ ਚੀਜ਼ਾਂ ਅਸੀਂ ਕਰਨੀ ਸੀ ਪਹਿਲੇ normally ਅਸੀਂ day to day ਕਰਨੇ ਆ we could make very rash and very wrong decisions. It affects our ability to control ourselves, causes disinhibition. Like we've seen, when you're probably discussing amongst yourselves that, oh, my uncle was so, or so and so, was so good, but when they start drinking, they start saying things or behaving in a manner that's so bizarre. So that's loss of inhibition. And eventually it also starts affecting the part of the brain that is responsible for learning and memory, which is the hippocampus. So, yaadasht kamzor ho jandi hai. Initially lagda hai ki, oh, it's helping with my sleep, but eventually it starts affecting your sleep architecture. Sleep the phases on the alcohol onu jaake kharab kar dindi hai. And a lot of times people present with chronic insomnia, chronic difficulty sleeping because of alcohol use. Now I'll hand it over to Dr. Simran Chawa to talk about the assessment and treatment of alcohol use disorder. Thank you.
So Dr. Asha and Dr. Mansi talked about alcohol use disorder, the medical aspect, the psychiatric aspect. ਇਹਦੇ ਵਿੱਚ ਮੈਂ ਗੱਲ ਕਰਾਂਗਾ ਹੁਣ ਜੇ ਸਾਨੂੰ ਲੱਗ ਰਿਹਾ ਵੀ we have this illness ਵੀ ਅਸੀਂ ਕਰਨਾ ਕੀ ਹੈ, like what to do, the assessment that's commonly done in the clinic or that we could even do at home to see ਵੀ ਕਿਤੇ ਸਾਨੂੰ ਇਹ ਬਿਮਾਰੀ ਜਾਂ ਕਿਸੇ ਸਾਡੇ loved one ਨੂੰ ਇਹ ਬਿਮਾਰੀ ਤਾਂ ਨਹੀਂ ਹੈਗੀ. So this is a questionnaire that's commonly asked in clinics. It's called the CAGE questionnaire. So it's 4 components. So one question that's asked is, have you ever felt that you should cut down on your drinking? That's the C. People, it becomes such an ingrained habit. It's such a part of our culture that we don't even realize that the effects that it has. And sometimes somebody will ask us, like, have you ever tried to cut down? Or we'll ask ourselves, like, maybe I should cut down. So this is one warning sign that we could have alcohol use disorder. Annoyed. Have people been annoyed? Kisi nu kite pareshani te nahi hoi sade peen de karan? Like, have there been consequences? Because a party de kuch hoya hove, ja ghar vich koi ladai hoi hove, so kisi hor nu takleef pahunchi hoye because of our drinking. So have other people been annoyed by the drinking? So guilty. Kevli sanu apne aap nu bhi badi pareshani hundi hai ki inna kuch ho raha hai, inne consequences ho raha hai, DUI bhi ho gaya, but fir bhi jada I'm not able to stop drinking. So have we ourselves felt guilty about the drinking? And then the last one, the assessment question is eye-opener. Have you ever had to have a drink first thing in the morning? Like the first thing somebody has to do is have some alcohol in the morning, because as Dr. Mansi was saying, sometimes the withdrawal symptoms start. You start shaking, you start feeling nervous, you start feeling sweaty. So that's a sign that this has become a very ingrained habit that can have medical, legal, personal consequences. So each yes is 1 point, and if there's 2 or more points, it suggests that there's a possible alcohol use disorder, and at that point we should definitely seek help from a professional. So far a lot of the presentation has been about understanding the diagnosis, understanding the neurobiology, But a lot of us may not know that there are actual treatments for this condition. So sanu nirash hon di lor nahi, sanu we don't need to lose hope that there are actually medications that can help us quit using alcohol. And what the studies have found is that combined treatment is the most helpful. So combined treatment ki hai both medications and structured intervention. So dawaiyan da bhi role hai, but also we'll get into this later, but there's certain meetings we can attend, like AA meetings, Alcoholics Anonymous. There's even meetings that are led by professional therapists, intensive outpatient groups. So when we combine medications with those, what we call in psychiatry, psychosocial interventions, it's much more effective than either alone. So the three that are most commonly used are naltrexone. So I'll talk briefly about how these work as well. So naltrexone ki kadiya, it decreases the craving for alcohol. Like Dr. Asha said, sometimes the smell of alcohol can trigger the desire to use it. Sometimes there's certain visual, verbal, auditory cues that trigger the desire, the craving. Naltrexone disrupts that pathway in the brain so that we crave the alcohol. Yeah, so this is proven to help people quit. Acamprosate, so Dr. Mansi talked about how the alcohol affects the neurochemistry of the brain. It increases certain excitatory chemicals in the brain, and it decreases those chemicals that inhibit that excitement. So acamprosate helps to restore that balance so that we no longer have that feedback loop. Like I'm feeling really nervous and shaky in the morning, so I have to have a drink. So acamprosate can help to restore that balance. So the last one we don't prescribe as often because it's only for highly motivated patients. So the reason is, this one is called disulfiram. What this will do is if we try to drink while on disulfiram, it'll make us physically sick, sometimes even requiring hospitalization, so like nausea, vomiting. But ida ki purpose hai ki jede patient nu bahut hi man vich uda pakka irada hai ki main nu chhadna hai, then they can take this medication as kind of like an insurance that even if I try to drink, I'll be sabotaged in that drinking. So there are medications that definitely can help. Now, these are some of the other resources that are available. There's a national helpline that's free, confidential. Alcohol use disorder, which one big stigma is like, what will people say if they find out? Sometimes, especially minority community, which ਅਸੀਂ ਇਹਦੇ ਬਾਰੇ ਗੱਲ ਨਹੀਂ ਕਰਦੇ because ਅਸੀਂ ਚਾਹੁੰਦੇ ਨਹੀਂ ਕਿ ਸਾਡੀ ਬਦਨਾਮੀ ਹੋ ਜਾਏ ਜਾਂ ਹੋਰ ਕਿਸੇ ਨੂੰ ਪਤਾ ਲੱਗ ਜਾਏ. So everything that happens here is confidential. So there's a helpline that's confidential. There's a crisis text line. Like Dr. Mansi was saying, if we're drinking at a very high level, like for example, high level would be like the criteria that we mentioned, 4 more drinks, or if there's physical symptoms, hat kamban lagpan, just sweating if we don't drink, then sanu ape nahi nu chhadna chahiye. We should go into a detox program. Because pehla, even if we feel like, nothing happens, the first day or two might be fine. Like there might just be mild symptoms like sweating, tremor. But the lethal symptoms that Mansi was talking about, where there can be seizures, there can be confusion, that can even happen on day 2 to day 5 of stopping alcohol. So that's why if we're drinking at a very high level, we shouldn't try to stop on our own because it can be lethal. Then we should go into inpatient addiction programs. There's also outpatient substance abuse experts, therapists who can help. And then there's different support groups as well. We'll go over these briefly. Some of these, ਅਸੀਂ ਕਈਆਂ ਬਾਰੇ ਸੁਣਿਆ ਵੀ ਹੋਣਾ ਹੈ. Alcoholics Anonymous ਬਾਰੇ probably ਅਸੀਂ ਸਾਰਿਆਂ ਨੇ ਸੁਣਿਆ ਹੋਇਆ. That's kind of a spiritual based support group in which they talk about surrendering to a higher power. ਵੀ ਇਹ ਸਾਡੇ ਵੱਸ ਦੀ ਗੱਲ ਨਹੀਂ ਹੈਗੀ ਤੇ ਮੈਂ ਆਪਣੇ ਆਪ ਨੂੰ ਸੌਂਪ ਦਿੱਤਾ. Now that higher power doesn't have to be anything spiritual. It can be a better version of yourself. So these groups are meant for anybody, like of any background. And there's also groups that are not spiritual based, like Smart Recovery, that uses psychotherapy based approaches. There's also one that I wanted to point out especially. There's one that's especially tailored for the Asian community. It's called MAI. It's based in Livonia. It's Michigan Asian Indian Family Services. And it's run by South Asians. So it's geared towards the needs of our community. And just like all the other ones, it's also confidential. So this is what we talked about a little bit. It's a mutual support program based off shared experience. There's no professional running the group. It's all people who have come together to overcome this problem. And these meetings could be anywhere. There could be like at local community centers. It's a lot about sharing, people coming out, people sharing their stories. It's a very personal group. So, yeah. And then this is the one that we talked about. There's other groups. Jinanu lage pi main धार्मिक चीज नहीं करना चाहता जब मैं चर्च जाके जो और कोई सेंटर विच होर आंदे सेंटर जाके नहीं करना चाहता. There's also something that's completely secular. This is the SMART recovery. It's free, draws on evidence-based cognitive behavioral therapy, motivational interviewing. It's focused on self-empowerment and not labels, supports abstinence and reduction.